Hi everybody, my name is Dr. Shannon White with Chiropractic Motion and Holistic Health, and today I really wanted to talk to you guys about Lyme disease. There's a lot of misconceptions about it out there, and I kind of wanted to just let you know what I have learned with all my training and experience with it. So one is that it is not just one phase of Lyme. There's actually 3 phases of Lyme. And the very first phase of Lyme is the acute phase. This is when the initial infection or bite happens. Most people think that you have to have a bullseye rash. Well, it's probably 30% or less of cases actually have a bullseye rash. What happens is the bite happens, maybe a bullseye rash does appear, people maybe get flu-like symptoms a few weeks later, they go to the doctor, and then they are given antibiotics for it. However, that is not what happens for most people. And one of the reasons is because ticks are not the only thing that transmit it. Anything that bites and transmits blood also transmits or can transmit Lyme, including mosquitoes, fleas, lice, all ticks, spiders, heck, I don't even know what else I'm missing. Lyme is also passed from mom to baby through the breast milk and through the placenta. We also believe it is sexually transmitted, and a lot of people are not really on board with that, but here's the fact of it is a spirochete. It's the same family as syphilis, therefore that is also a sexually transmitted bacteria, so why would Lyme not be as well? We also know it likes to live in sperm, so you can connect the dots. This is also a big reason why so many people have Lyme disease, but they don't even know it. I estimate at least in Iowa, at least 50% of us people actually probably carry the bacteria in us. There's some people who I've read studies that show by now at least 90% of us carry the bacteria in us. We don't all show symptoms, and what the reason why is it all comes down to how strong is your immune system, and we'll get back to that. The second stage of Lyme is the dormant stage. So if you are lucky enough to have a bullseye rash and the symptoms, you'll go to the doctor, they'll give you a couple weeks of antibiotics, and you think you're done with it. Well, no, it actually goes dormant. And when you're given those antibiotics, you actually force the Lyme to create something called biofilm. And what it does is, think of it performing or making this protective barrier, this cocoon around it. And the antibiotics cannot penetrate, they cannot get through to it. And so it goes dormant sometimes for a month, sometimes for several months, sometimes for years on people, depending again how well your immune system is adapting to it. And eventually it comes out of the biofilm and it starts moving and migrating through the body again, wreaking havoc on it. Third stage is the chronic stage. And unfortunately, this is where most of the people fall into the category that don't realize they have Lyme until they get to the chronic, what we call autoimmune stage. By this point, most people have had Lyme for a long time. It maybe went dormant, and then it comes back as autoimmune disease. And the best way to kind of explain that is, I'll give you a quick 101 lesson on the immune system. So when something comes into our body, we have an invader. And our body, what it does, it sends like a B cell, which is part of our immune system, to recognize what's there. The B cell then's job is to tell T cells what is there. Those T cells' jobs are then supposed to make antibodies against whatever is invading our body. The problem is that Lyme lives and deactivates those B cells. So now your body knows that there is an invader. It sends T cells to recognize it, but when the T cells can't figure out what is there, it actually starts attacking yourself. And this is where we get a lot of autoimmune diseases associated with Lyme, or Lyme that result in autoimmune diseases. Those include MS, lupus, Sjogren's, ALS. I mean, you can name down the line. There's tons of autoimmune diseases. Hashimoto's is a big one. So anybody that is suffering from autoimmune disease should also be checked for Lyme disease. And here's the other thing. We're in Iowa. We're very outdoorsy people. A lot of people, again, will say, well, I've never been bit by a tick. Well, have you been bit by a mosquito? Well, a lot of us have. And not that every single insect carries it, but it is very, very common. The other thing about Lyme, and I talked about this already a little bit, is it all comes down to how strong your immune system is. And this is why you could see one person have a few little weird symptoms and not even think of it being as Lyme, and others that come to me that are bedridden, in a wheelchair, have no energy, can't work anymore, they're so run down. And the difference is, there's lifestyle that plays a role. How hard have you been on your body? How good is your diet? People who eat better, who take care of themselves, have a better chance of controlling the bacteria. However, some people can still do that and still have an issue, and it can also come down to genetics. We have something called the MTHFR gene mutations that also play a role in this whole aspect of Lyme. People who have these genes and they are activated, and Lyme can activate them, have a hard time detoxing. Their body doesn't process things through the liver properly. There's other issues that come along with this. So not only do these people have Lyme, they now can't detox things out of their body, and they become sicker and sicker. So I would say in families, I get a lot of families into the office. You could have 5 people, mom, dad, 3 kids, maybe a couple of them are sick, maybe a couple aren't sick, and they all could show Lyme. And it comes down to how strong is your immune system. When it comes to Lyme, there is 3 options of course of treatments or ways to deal with the symptoms. The first one is antibiotics. They have not been super successful. They will not get rid of Lyme as either. So people who have been on antibiotics and they think their Lyme is gone, just realize it may not be. Symptoms could restart up, and even maybe completely different symptoms in the form of autoimmune diseases years later. Herbs are another option. Herbs kill Lyme as well. However, they do not kill off the rest of your immune system and your microbiome like the antibiotics can. The third option is homeopathy. Homeopathy actually does not even kill Lyme. What it does is it's supposed to be stimulating your body and your immune system to wake up and recognize and take control of it on its own. So those are the 3 options. The 2 that I focus on more are the herbs and the homeopathy, just because they're less damaging to the overall immune system long term. Lyme is also very tricky. One of the reasons why antibiotics aren't super successful with it is because, one, it's a shapeshifter. And so it's actually a spirochete that can straighten and bury itself in the tissues deeper. This is also why the blood test for Lyme is very inaccurate. If you've been to your general doctor, just have them checking for Lyme, the blood test is at best 30% accurate. There are some labs, one called IGeneX in California, that is a little bit more accurate, but still not 100% accurate. So a lot of people who are diagnosed with Lyme either A, are lucky enough that they have some antibodies in their body, so it shows up on the test, or they have been to somebody like myself who does electrodermal screening, biofeedback type testing, and we recognize the bacteria, or they've been to other doctors who've ruled out everything else and just assumed that it's Lyme. So that is an issue with it as well. The other thing is Lyme is not just Lyme. It's never by itself. There's many co-infections that go along with it. So if you only focus on Lyme, you're never going to get healthy either. Some of the most common ones is something called babesia. It causes a lot of neurological brain issues. Another one called Bartonella causes a lot of ringing in the ears, some heart palpitations, digestive issues, cramping in the calves, burning in the hands and the feet, sometimes like plantar fasciitis. Mycoplasma pneumonia is a huge factor. It is known to affect the lungs. However, it affects all mucosal lining, including your gums, your sinuses, your bladder, your joints. It also causes a lot of chronic fatigue syndromes. That also leads me to one of the biggies, which is Epstein-Barr virus. Now, 90% of us carry this virus in our body already, and what Lyme does is it lowers the immune system and allows it to take over. And Epstein-Barr is known as the virus that causes mono. However, you may not have full-blown mono, but you can have chronic fatigue or thyroid problems. Epstein-Barr virus is known to live in the thyroid, therefore the body starts attacking it and attacks the thyroid. And that's where you get a lot of the Hashimoto's diagnosis from. Epstein-Barr also is big with fibromyalgia diagnoses. Let's see, what are some other good co-infections? Coxsackie, known as hand, foot, and mouth. cytomegalovirus, herpes simplex virus. Most of Lyme patients have a disrupted gut, and it's either because Lyme is disrupted or they've been on so many antibiotics that it's disrupted the gut. So they often have problems with Candida, C. diff. H. pylori is a big one. H. pylori is the one that causes reflux and heartburn and indigestion and that bloating and that pain you get here after eating. But what a lot of people don't know is that H. pylori also affects the gum and your gums and your sinuses. If you think about it, we're one big tube. Everything is connected. I've actually seen H. pylori trigger a lot of anxiety on people. So a lot of these things all put together, you can see why some Lyme patients get so sick. So they didn't get Lyme and all of these things necessarily with it. Some of these are common infections we naturally carry in our body, but when Lyme is present, it lowers the immune system, allows them to take over or reactivate and basically wreak havoc on the body. So if you know anybody that has symptoms of chronic fatigue, brain fog, inability to form words, ringing in the ears, heart palpitations, anxiety attacks, digestive issues, muscle pain, especially muscle and joint pain that is wandering and it moves throughout the body. These can all be signs of Lyme disease. It's not just your typical bullseye rash, joint pain, flu-like symptoms, and you're over it. It continues to linger in the body and cause issues down the road. So I encourage people who have been diagnosed with an autoimmune disease to look into this as a possibility as well. I hope everybody learned a little something about Lyme today, and if there's anything I can do, let me know. I will also at the bottom of this post a sheet that has a whole bunch of symptoms on it, and that's the funny thing about Lyme is a lot of symptoms we explain away by other things, like, oh, maybe it's because I'm tired, because I have little kids I'm tired, or I have these joint pains because I'm getting older. But what happens is when you start looking at these list of symptoms and going, oh, I have that one and that one and that one and that one, and you start connecting the dots, it can give you a better idea of what is actually going on. So I will post that so everybody can look at that as well, but have a great weekend.